Hello and welcome. My name is Diana Kleins, and I'm the Executive Director for the American Association of Kidney Patients. On behalf of the AAKP, we're excited to welcome you to this special HealthLine webinar in recognition of National Phosphorus Awareness Day. In 2024, AAKP launched its inaugural National Phosphorus Awareness Day on April 5th, adding to the association's suite of other successful campaign efforts, including our Are You OK campaign, recognizing National High Potassium Awareness Day, Stop the Itch for National Itch Day, and our Every Patient Safe Infection Prevention and Emergency Preparedness campaign for National Safety Month. Year one at AAKP's The Hidden P in Kidney Disease engaged an audience of over 50,000 kidney patients, families and care partners, and kidney healthcare professionals. And this year, we are on track to break that record. In the run up to this Awareness Day, we hope you visited our campaign website, thehiddenpinKidneyDisease.org, to access new educational materials, our interactive items such as our phosphorus word search and test your knowledge quiz, as well as read articles about fellow kidney patients on how they've managed their phosphorus levels. We encourage you to share these resources not only on April 5th, but all year round with others you feel could benefit from more tools and resources understanding the phosphorus kidney connection. Throughout today's program, we'll be joined by a fantastic panel of experts and patient advocates who will share their insights and personal experiences. My friends, please sit back, relax, and enjoy the presentations. And of course, take some notes so you can put what you learned today into action tomorrow. Before I toss the program over to Jerome Bailey, AAKP's Director of Patient Engagement and Advocacy, here's a brief message from our National Phosphorus Awareness Day sponsor, Ardelyx.
Thank you, Diana, and hello, everyone. As Diana mentioned, I'm Jerome Bailey, AAKP's Director of Patient Engagement and Advocacy, and I'm excited to be with you all today as we dive into the hidden P in kidney disease. If you didn't already know, P is the scientific symbol for phosphorus, a mineral essential for life but often hidden in the foods we eat and in the impact it can have on our health, especially for those with kidney disease. In fact, P is also hidden in the word kidney itself, upside down by the letter D, which is why AAKP launched this unique awareness campaign. For those living with kidney disease, excess phosphorus can build up in the body, leading to serious health risks like bone disease, heart disease, and other complications, all of which are often silent until it's too late. That's why we mark April 5th, 4.5, as National Phosphorus Awareness Day, representing the target phosphorus level of 4.5 milligrams per deciliter or less for kidney patients. Today, you'll hear from experts and patients who will share their knowledge and personal experiences managing phosphorus and maintaining kidney health. Before we get into our presentation, this year's National Phosphorus Awareness Day is especially important given a 2024 decision made by the Centers for Medicare and Medicaid Services to move all oral only therapies into the phosphate, including phosphate lowering therapies or PLTs, into Part B of the End Stage Renal Disease Medicare Prospective Payment System, commonly known as the bundle payment system. AAKP strongly opposed the 2024 CMS leadership and staff decision as anti patient, believing that this action would interfere with kidney professionals and their ability to exercise their best expert medical judgment on how to tailor the right medicine at the right time to the right patient in order to improve health and quality of life. We also believe the 2024 CMS leadership and staff decision was contrary to the 2019 executive order on advancing American kidney health and the goals of keeping kidney patients as healthy as possible, avoiding preventable complications, and ensuring transplant readiness. To better understand the real world impact of this CMS policy decision that took effect January 1st of this year, AAKP conducted an independent flash survey through our Center for Patient Research and Education to hear directly from patients, caregivers, and medical professionals regarding any issues they may have experienced related to patient choice to phosphate lowering drugs, including barriers to access or delays. AAKP Vice President and Chair of Policy and Global Affairs, Paul Conway, will join us to share current results from the survey. Paul is a former dialysis patient and currently a 28-year transplant recipient. He has been recognized for his advocacy work with several national awards, including the President's Medal from the American Society of Nephrology and two Presidential Service Volunteer Awards in 2020 and 2022. Paul has served in 4 U.S. presidential administrations, including as Chief of Staff for the U.S. Department of Labor. He was selected by the FDA to serve as the inaugural chair of the Patient Engagement Advisory Committee and has served on the American Board of Internal Medicine Nephrology Specialty Board, as well as multiple CMS technical panels related to dialysis quality improvement measures. Paul, welcome. I turn the program over to you.
Thank you very much, Jerome, and thanks for your ongoing service to AAKP. Your skill and empathy for patients has been tremendous, and your effectiveness in advancing AAKP's mission of educating patients on the right drug at the right time has made us a highly effective organization. As Jerome just mentioned, there have been some dramatic changes that have happened in patient access to phosphate-lowering therapies since January 1, 2025, and those changes took place in 2024 with policy decisions made by CMS. We've been tracking very closely comments from patients about interruptions in their care and their access to PLTs. Most interesting, we've seen it in the media as well. One of the most respected news outlets in the skilled nursing facility is McKnight's Long-Term Care. And in this article, you'll see the reporter Kimberly Marsalis reported on initial interruptions that were occurring for dialysis patients in skilled nursing facilities. But what it zeroed in on were the interruptions in care being experienced by both patients and providers among some of the most vulnerable people, those in skilled nursing facilities on dialysis. So what we decided to do was launch a survey to our patients and healthcare providers, asking them for more granularity on exactly what they were experiencing. This survey does remain open, and we're strongly encouraging patients and healthcare providers to participate in the survey and give us more details about what they're going through. So please log on and check out the survey. In the first slide, we asked whether or not patients or a loved one currently take one or more phosphate-lowering therapies to help manage their serum phosphorus levels. This is known as hyperphosphatemia. 43% said yes, 51% said no, 6% were unsure. This was just kind of a level setting slide to give you a feel for how much the population is actually on these. And we asked, since January 2025, have you or a loved one experienced any disruption in obtaining oral phosphate lowering medications? 38% of the patients said yes, 48% of the patients said no, 15% were unsure. For a disruption in a therapeutic, this is an extremely high number to have almost 40% of your patient population having that kind of an interruption. This is what we call the unintended consequences of government determinants of health. Then we also asked, since January 1, 2025, have you experienced any disruption in your ability to prescribe oral phosphate-lowering medications to your patients? This question is obviously directed to healthcare professionals. This was a stunning number for us. 72% of healthcare professionals that are involved in prescribing these therapies indicated that they were having difficulties since January 1. That corresponds directly to what we saw in the McKnight Long-Term Care News article by Kimberly Marsalis. Patients saying no was 18%, unsure 11%. So then we asked patients and physicians, should patients have access to all safe FDA-approved medications that improve patient health and decrease the burdens associated with other and older types of treatments? This question went directly to the idea that patients should have a choice and access to the latest innovations that help them manage their condition, including high phosphorus. 96% of survey participants have said yes, 0.5 said no, and 4% are unsure. What we decided to do then is to collect the qualitative data, in addition to quantitative, the direct feedback from patients and healthcare providers. So we went out and we asked open-ended questions, and here are some of the responses. If you're a patient or a caregiver or a healthcare professional, please explain how this disruption in obtaining these medications has impacted people. And so here's one right here. Many patients have gone without any binders to date. This is from a healthcare professional. This has caused undue stress on patients and caregivers. Another response from a patient. I'm currently without my medication. I've not had it for several months. I've been waiting on normal medication for 4 months. We have no idea when it's going to come. And I live in a rural state, and getting the binder to my patients in a timely manner has been a concern. That's from a healthcare professional. We asked, have you had to make any changes to your or your patient's diet, lifestyle, or treatment plan because of issues obtaining phosphate-lowering medications? And if so, how has that affected your health or quality of life? This question went to both patients and healthcare professional. And you can see right here in the first response, yes, patients with delays in obtaining their binders have had to use alternatives until binders become available, including out-of-date types of therapies. Another one said, yes, patients are more anxious and have to cut down on pills to keep some on hand. And a patient responded, yes, when my phosphorus is high, I have to deal with uncontrollable itching, and the medication for that makes them tired and they can't function well. And finally, we had a comment from a patient saying they already have a limited diet. Phosphorus is in so many things, it's difficult to eat anything, and they're losing weight. And then we asked this question. If you're a patient, caregiver, or healthcare professional and have spoken with your healthcare provider or pharmacist about challenges in getting your PLTs, what advice and solutions were you offered? And were they helpful? So these are the practical feedback type things when people run into a problem. What are they hearing? I discussed it with the pharmacists and other clinic managers with no resolving solutions. I spoke with the dietitian who recommended some changes to my diet until I get my binders. I spoke to my physician about what if I can't get my phosphorus binders, and I was told to be hypervigilant about phosphorus intake if that happens. Another one got the comment, there are no other solutions available, and little help was offered. Another patient said, my doctor prescribed 90 days, but Medicare reduced the allowance to 30 days. And the last comment here is pretty interesting. Of course, I've spoken with other healthcare providers and with pharmacists. Patience was the most helpful solution. So when we step away from this data, and we take a look at the survey results in terms of numbers and then the qualitative data, what's coming across to us is that the policy that was implemented on January 1st was not patient-centered. The consequences weren't well thought out. They weren't well reasoned. And probably most importantly, patients weren't asked what they thought might happen, nor were healthcare professionals. We think policy should be done differently. We think policy should be patient-centered. And most of all, we think that when consequences are experienced by some of the most vulnerable people, patients on dialysis, patients with high phosphorus, the solution should be forthcoming quickly. And we think this policy needs to be revisited and changed. We'll be working with Congress to try to affect that, and also with the new administration, because as you can clearly see, something that was thought about in 2024 and implemented on January 1st, 2025 has had a negative impact on patients. This is what we call government determinants of health, when government takes action either knowingly or inadvertently that has negative consequences for patients. So we hope you appreciate this webinar and take the survey. We'll also make the article available. Thank you very much.
Thank you, Paul. Without further ado, let's kick things off by giving a warm welcome to our first speaker and good friend, Anna Marie Rodriguez. Anna Marie has worked as a nephrology dietitian for over 25 years in a variety of settings, from clinical to pharmaceutical, including sales, education, and renal medical affairs. She is currently an independent consultant, the owner of Nutrition Directions LLC, and employed by Pentec Health as a renal clinical retention specialist. She has served and chaired several boards, including the South and Central Texas National Kidney Foundation Medical Advisory Board, San Antonio Council of Renal Nutrition, the Academy of Nutrition and Dietetics Renal Practice Group, and several groups within the Dietetic Practice Group. Anna Marie is no stranger to AAKP. She is the recipient of the 2025 Medal of Excellence Award in the Dietitian category and was an original reviewer of AAKP's popular Delicious program, which features over 100 kidney-friendly recipes. Anna Marie, I turn the presentation over to you.
Thank you so much, Jerome. It is both an honor and a privilege to be here with AAKP and to talk about my favorite subject. As always, anything that has to do with kidneys, I am there for everyone. So we're going to begin and talk about the hidden P in kidney disease. And specifically, we're going to hone in today on talking about phosphorus. First, a few disclosures. As Jerome mentioned, I am self-employed. I own Nutrition Directions, and I'm full-time employed by Pentec. I'm on several speakers' bureau, and I'm an ambassador for Orgain. So let's begin our focus on phosphorus. And today we're going to talk about how we navigate phosphorus management in kidney disease. It can be quite tricky. There's a lot of moving parts with phosphorus management. And it is my hopes that after today, you'll feel a lot more comfortable about this. Kidney health is supported through nutrition. More than half of the nutrition for chronic kidney disease is through nutrition care, and this includes phosphorus management. What makes this a little bit tedious, though, is that phosphorus is found in all living matter, whether it's plant sources, animal sources. It's found in almost all the food we eat because of it being found in all of these living matter widespread. Phosphorus abbreviation is P, and that's why we're looking for the hidden P in kidney disease. Makes it a little bit fun. And I like to think of this as a little bit fun. We shouldn't think of it as too tedious or too hard, even though anything that has to do with diet and restrictions can sound a little bit daunting. As I mentioned, hopefully after today, it will not seem so daunting. But phosphorus is a mineral that's essential for life. It's essential for energy production. It's essential for genetics. In fact, it's in all of our DNA. It's needed for growth, maintenance, and repair of all of our body's cells and tissue. And it's necessary for healthy bones and teeth. In fact, about 85% of our body's phosphorus is in our bones. Calcium and phosphorus are the most prevalent minerals in our body. You might think, my goodness, we have so many needs for phosphorus. We must have to eat so much of it. But on the contrary, we only need a small amount of phosphorus. A little bit goes a long way. And how we measure phosphorus in our body is through a serum test, a blood test. A normal phosphorus level is between 2.5 and 4.5. If our serum phosphorus is elevated above 4.5, then this means we have high phosphorus or hyperphosphatemia. We might wonder, what exactly are the goals of phosphorus management? Why should we pay so much attention to this mineral, considering the fact that we need it for so many life management within our body? What is so important about managing this so stringently between 2.5 and 4.5? It is simply to minimize the risks for bone and mineral disease and decalcification of soft tissues and blood vessels. As I mentioned, the bulk of our phosphorus in our body is in our bones. If our phosphorus level is too high in our body, then our bones will basically become weakened they may become brittle. And what ultimately happens is the phosphorus and calcium will calcify in other areas of our body instead of in the bones where it belongs. This is what's referred to as the calcification. And this occurs in all of our soft tissues. Think of our heart as a soft tissue. It's a muscle and it's very strong. It needs to be pliable or elasticity. It has to have this ability to pump blood very freely. And we need it to maintain that elasticity and strength. But if it becomes calcified, it becomes a little brittle, it becomes hard, and it can't freely pump the blood as easy as it normally would. That is the calcification risk. And this can happen in any of our body's organs, including our lungs. So that is why we must manage our phosphorus within these very narrow guidelines. How exactly is phosphorus managed? Well, it is rather managed individually. The management, it's going to vary between person to person, and it can depend on the level of kidney disease as well. Your healthcare team will help identify actions that are needed to keep your phosphorus in very well-controlled levels. Your dietitian will help you understand which foods might need to be tailored back a little bit or sometimes eaten more of. And there are times when diet alone isn't going to be enough. So phosphorus medications such as phosphate binders or phosphate blockers might be necessary to help manage phosphorus. So diet and medication are largely the two mechanisms for managing phosphorus. If kidney damage is very severe and dialysis is needed, then dialysis will help clear out the excess phosphorus that's in the blood as well. So let's focus on diet for a few minutes. Well, maybe a lot of minutes. Let's look at the fun food facts label that I absolutely love, and it's very useful so that we can find out what exactly is in the foods that we eat on a daily basis. We can find out the serving size, how many calories are in our food, the fat content, cholesterol, sodium, the carbs, the protein. We can also identify how much potassium is in our food. But we cannot identify how much phosphorus is in our food by looking at the facts, the nutrition facts label, sorry. But how we do find out is by looking through the ingredients. Phosphorus absorption through all of our foods varies. So the absorption is different depending on what foods we're eating. Makes it a little bit more difficult to navigate. Because the phosphorus is not on the nutrition facts food label, we have to find the hidden phosphorus in the ingredients. This hidden phosphorus is the added phosphorus, or what we call inorganic phosphorus. This is not naturally occurring phosphorus. These are additives or preservatives. And what I'd like to point out is that these additives, or the added phosphorus, is absorbed by our body by almost 100%. That's why it's very important for us to become accustomed to looking for the added phosphorus in the ingredients. So with all of that, how would we find the phosphorus in the ingredients? Some food labels have a very extensive or long ingredient list. It can be overwhelming to look for one food item in that very long ingredient list. But when we're looking for phosphorus, we want to look for the key word PHOS. If you note the words that are on your slide, sodium phosphate, phosphoric acid, sodium hexametaphosphate, tetrasodium pyrophosphate, they all have that PHOS in common. That's how we find that hidden phosphorus. And some of these words are pretty big, but the PHOS is the common denominator. As I mentioned, phosphorus absorption in our gut varies, and the phosphorus that's in plant forms is in the form of phytate or phytic acid. This is largely indigestible because humans have a very low amount of phytase in our gut. Phytase is the enzyme that actually breaks down the phytate or the phytic acid. So the phytate needs to be hydrolyzed in order to release this phosphorus for absorption in our gut. What this simply means is that the phytate or phytic acid needs to be broken down to release the phosphorus for absorption. How do we hydrolyze phytic acid and make it more available for absorption? This is where that keyword bioavailability comes into play. Cooking methods such as high heat, soaking, fermentation, and sprouting, these are all forms of processing that hydrolyzes or makes phosphorus more bioavailable for absorption. Commercial food processing uses very high heat and extrusion processing that makes the phosphorus more bioavailable. So fresh is almost always best, and rather than buying commercially prepared foods, because those foods will have higher bioavailability of phosphorus for absorption. So the pro tip here for you is to consider both the actual content of phosphorus in the food and the bioavailability from the various food sources. As I said, they're all different, and fresh is always best. As I mentioned, bioavailability is different between all foods. The absorption is going to vary. So let's break that down a little bit and think of it in terms of, is it organic, which is natural, or inorganic, which is unnatural? The natural sources are available through animals and plants. Remember, I stated that phosphorus is widespread among all living matter. If we look at fresh meat, fish, seafood, or poultry, or dairy, the phosphorus is going to be absorbed about 50% or more, and up to 80% for milk. And the reason why is because there's no fiber, there's no muscle tissue, there's nothing holding the phosphorus in place in milk. So it's going to be absorbed really rapidly. But when it comes to plant sources such as nuts, seeds, veggies, legumes, the bioavailability of phosphorus is low. Remember what we just talked about with the phytate or the phytic acid. It needs to be hydrolyzed or made available for absorption. So the absorption of the phosphorus from the plant sources is going to be much lower, 50% or less. But to keep things really simple for us, just think in terms of phosphorus from natural food sources is going to be absorbed about 50%. That keeps it very simple. I want to point out also that plant-based protein, if we're eating fresh plant-based protein, it will not have the additives that's used in a lot of meat processing at this time, such as phosphorus and potassium-based preservatives. But if we start to include foods that are enhanced meats, or basically the fake meats, those are processed foods. And once we start including more processed foods, or fast foods, ready-to-eat foods, commercially processed foods, then they typically will have additives or preservatives in them. So that becomes very important for us to look at the ingredients, because remember, it won't be on the label, but it'll be in the ingredients. And again, those additives are going to be absorbed up to 100%. So the pro tip, it's the same as before. Eat fresh. Avoid processed and ready-to-eat or convenience foods, and check the ingredients. And this holds true for sodium as well. If it's not natural, try to avoid it. I want to focus on protein intake as well, because protein intake can actually impact phosphorus intake. So let's look at the protein needs that we typically see with persons that have kidney disease. Adults with chronic kidney disease who are on dialysis, whether it's hemodialysis or peritoneal dialysis, require dietary protein of about 1.0 to 1.2 grams per kilogram based on body weight per day. So let's look at an example of a person who weighs 150 pounds. This person would need about 9.5 to 11.5 ounces of protein a day. Let's pretend that 9.5 to 11.5 ounces is from beef roast. The phosphorus from that amount of beef roast is going to be about 563 to 682 milligrams. Consider a person who has chronic kidney disease who's not on dialysis. In this instance, we would want those patients to follow a low protein diet, and that is 0.55 to 0.6 grams per kilogram per day based on body weight. So using our same example of a person who weighs 150 pounds, this person would then need 5 to 6 ounces of protein. Pretending that we're still having beef roast, that phosphorus would be 297 to 356 milligrams. So you can see the difference of the phosphorus that we would get in the diet depending on how much protein we're eating, whether we're on dialysis or CKD, stages 3 to 5, not on dialysis. Now let's switch gears a little bit and talk about the plant-dominant low-protein diet, the Plateau diet. This is using a low-protein diet of 0.6 to 0.8 grams per kilogram a day. This indeed is not a low-protein diet. This actually is a normal protein diet. But what makes this unique and special for kidney disease is that it's about 50% or more of plant-based protein. And that is kidney friendly, kidney safe, because it is more alkaline. Whenever we're eating more plant-based foods, we're going to have lower sodium intake and higher fiber intake as well, which are both kidney protective. So this makes it a very kidney-friendly diet. Let's look at the same example that we did before using someone who weighs 150 pounds. Using this 0.6 to 0.8 grams per kilogram, this person then would need 6 to 8 ounces of protein per day. So if we use the example of 50% from animals and 50% from plants, this is what the daily intake might look like. 3 ounces of beef roast for dinner, and maybe that's 21 grams of protein and 178 milligrams of phosphorus, and then perhaps 4 ounces of tofu, tofu scramble for breakfast. This would be 8 grams of protein and 101 milligrams of phosphorus. And a half a cup of black beans, maybe some black bean tacos or beans and rice for lunch. This would be 8 grams of protein and 120 milligrams of phosphorus. And then perhaps we're going to make some hummus for a snack using a half a cup of chickpeas, which would be 7 grams of protein and 138 milligrams of phosphorus. If we look at all of this food, which is quite a bit, that is only 44 grams of protein, which falls right in the range of what's needed for this particular eating plan. And the phosphorus comes to 537 milligrams. Keeping in mind, only about 50% is going to be absorbed either way. We talked about finding the phosphorus and knowing that it's not in the facts label, but it is in the ingredients. So let's practice that. The tried and true method to locate hidden phosphorus on the ingredients list is to seek the 4-letter word PHOS. So if we look at the label to our left, we can see within the purple circle, there is no words that have PHOS in that. So there's no phosphorus in that particular food item. But if we look at the green label to your right, we can see there are several phos words in here: hexametaphosphate and phosphoric acid. I would like to also point out that there is also sodium and potassium and calcium. This may not be a very healthy choice for someone who has kidney disease. Here's another example using a beverage lineup. Now I do have the brand name blocked out, but the first beverage is a sports water, and the next beverage is a lemon lime diet soda. Now, the ingredients that we see on the top belong to the sports water. And we see that this particular beverage has hexametaphosphate. So this one does have phosphorus in it. If we look to the second list of ingredients that belongs to the 50-50 soda, there is no phosphorus in this. So this would be your safer choice. However, I'd like to point out there is potassium in both of these. Although if we look at the amounts that we see in the ingredient lists, there is less in the 50-50 diet soda. That would be a little bit safer. As I mentioned earlier, nutrition intervention alone is not often enough to control phosphorus. Diet management can go a long way, but as kidney disease continues to escalate and our kidney function continues to decline, then we may not be able to remove all of the phosphorus in our urine, and it may build up in our bloodstream. That is when we'll need to use medications to help keep phosphorus management under control. If our kidney disease progresses to the point where we're no longer to eliminate toxins and excess minerals, we may need to have dialysis. All three of these, diet, medication, and dialysis, are used to control phosphorus. Usually between stages 3 to 5, not on dialysis, diet is almost always going to be enough. But as we inch towards stage 5 and kidney disease progresses, it does become more difficult for our body to maintain all of the minerals within a proper balance. This is when it becomes necessary for us to talk about medications with our healthcare provider. And I urge every one of you to be your best advocate. Know what is best for you and what works best as far as interventions are concerned. There are several different phosphorus medications, such as a binder or a blocker, that are used to prescribe and maintain serum phosphorus within normal limits. Let me tell you how these work. Your phosphorus binder is taken with meals or with snacks. The key is to take them with food. The dose will vary depending on how many you might need to control your phosphorus. Sometimes you might start out with one each meal, and as kidney disease progresses, you may need to up that. It's not necessarily something that you might be doing wrong, but we at the same time need to eat enough to keep our bodies healthy and strong. So we don't want to starve ourselves. We do want to enjoy our food. So sometimes phosphorus binders give us that extra phosphorus management while we still maintain the food that we need to eat to stay strong. Now, when we take the phosphorus binder with our food, it simply binds to the phosphorus while the phosphorus is in the gut, and it does not allow it to be absorbed into the bloodstream, so that when we go to the bathroom, we have a bowel movement, it's eliminated in the stool. Blockers work very similarly, except they don't need to be taken with food. They're only taken once to twice, usually twice a day. And they work similarly, but they don't bind, they block. So they work really well in the small intestine, again in our gut. They block the phosphorus from getting absorbed into our bloodstream, and then we eliminate that phosphorus when we go to the bathroom and have a bowel movement. So either way, these are very useful medications that can keep our phosphorus under control, and we can still enjoy the foods that we need to stay healthy and strong. But be your best advocate. Know what works best for you. I want to share also that there are enormous amount of resources available to help you navigate your kidney disease, your diet, your phosphorus management. And AAKP is no different. You'll note on the AAKP website, there are numerous resources that will help you take charge and be your advocate. There's resources on high phosphorus, educational resources and brochures. Browse through past articles to find out more information. The AAKP magazine and e-newsletters are all available online, as well as past webinars that you can pull up and review at your heart's content. But what I love the very most, because I'm a dietitian and I love food, is the recipes. Kidney-friendly recipes are in a very wide variety, and whether you have CKD stages 3 to 5, on dialysis or not on dialysis, stage 5 on dialysis obviously, or have had a transplant, have diabetes, these recipes have all the information you need to make good choices. At this time, I'm going to turn it back over to Jerome, and we're going to get cooking in a few moments.
Thank you, Anna Marie, for that insightful presentation for our AAKP members and viewers. I'm thrilled to introduce our next guest, Chef Nina Curtis. Chef Curtis is a director and executive chef at Plantish & Co. Culinary Arts, where she is a trailblazer in the world of plant-based cuisine. Recognized as one of the top 25 women in food services and hospitality for 2024, Chef Curtis is known for her innovative and exquisite approach to plant-based dining. With over two decades of experience, Chef Curtis has captivated both vegan and non-vegans alike with her culinary creations. She made history as the first guest chef to create a plant-based menu for a White House state dinner. In addition to her culinary talents, she is a passionate advocate for plant-based livings, sharing her knowledge through lectures and dining experiences. Her leadership roles and commitment to excellence, combined with her rigorous training and MBA from Pepperdine University, highlight her dedication to advancing plant-based cuisine. Today, Chef Curtis will be showcasing her skills in a cooking demonstration featuring a recipe from the newest edition of our AAKP Delicious series. Let's step into Chef Curtis' kitchen and begin our exciting cooking demonstration.
Hello, Jerome. Hello, everyone. I'm thrilled to be here with you today. I always get excited when I get to work with Anna Marie and Jerome and all of you, because people will ask me why I became a chef, and I just love to eat good food like I think all of us do. I took it to the next level and really have studied a lot and cooked all over the world. So I was thrilled when AAKP shared with me the newest of their recipes, which they have so many that they offer already. And there I saw what I knew I wanted to make because it's one of my favorite. And that's the sesame tofu wrap. It's really easy. I always share with people ways to, prep ahead of time so you don't have to worry about doing a lot of cooking like maybe chefs do in the kitchen all the time. Because when I'm off of work, when I'm in my own kitchen, as I am right now, I just want to eat like you. So let's get into it. We are going to be making the sesame tofu wrap. This recipe will serve 6. And even if you aren't planning to serve 6, I would suggest you make the full recipe because you'll have so many great things prepped, and some of them you can use for other things. So as you see, the recipe calls for the 16 ounces of tofu. I always recommend a good source of tofu, organic. And remember, tofu to be made is much the same as cheese is made. So we take water, we take soybeans, organic, and we take a coagulant, and that's the same process, very simply put, as making cheese. But tofu has this very neutral flavor that you can do so much with. From what we're going to do with it, as I'm going to share with you, from the recipe to so many other things. But the marinade and the tofu are the best. I always keep tofu marinated for different purposes throughout my week. This particular recipe is calling for 16 ounces of tofu. I already said organic. And we're going to cut it in 12 cuts because it's going to go in the wrap. You could cut it as steaks. You could sear it. There's so many wonderful things to do, but this is such a delicious wrap. I can have one multiple times in the week. I try to balance it. But the marinade is a blend of rice vinegar. You see the recipe that you have. We've got fresh ginger, fresh garlic, and I really recommend you take the time to mince the garlic and grate the ginger. And if the best you can do is, a jar from the store, I'll take that. But the aroma and the flavors, and just really how when we talk about food as medicine, these ingredients are able to work. It's just beautiful. We have soy sauce, low sodium, if you choose. I chose to put it in this. And we have just a little bit of sesame seed oil. And you can just see all the goodness there. And I'm just showing you. So it recommends to marinate the tofu at least 1 hour or overnight. I choose to be a little bit prepared, and I like to marinate things. I also recommend you pressing out the tofu because it usually comes in liquid so it doesn't dry out. And that can be as simple as draining it, wrapping it in a towel, and then putting one of your heavier, like your cast iron pan, putting it in a dish so the juice absorbs out. Because then it will be like a sponge that we just squeeze all the water out of. So when you put the tofu in the marinade, it really is just like that, a sponge, and it really absorbs all the flavor all the way through, not just on the top. So when you bite into it or you serve the sesame tofu wrap to someone, they're not just going to get that outer layer of flavor that I've often experienced when I go out to eat, but they're going to have the taste all the way through. And that's that yum factor, right? It's just like, oh gosh, I love this. So I have marinated. I prepped this yesterday. So it's been now about 24 hours. We're going to get to that. And then we make a dressing. 1 second, and let me grab that.
That's a really good reminder to press the tofu to get the excess liquid out before marinating, so you have the full flavors all the way through. That's a really good reminder, Nina.
When you think about it, I don't think anybody will be able to look at a sponge on their sink that's full of water. You couldn't pull anything up if you had a spill, right? You've got to squeeze it out. And then I use that analogy all the time, and then it seems to stick with people. So
it's
I hope
a good analogy.
Yes. And so then we made this beautiful dressing. And this I did also ahead of time because this dressing you can put on your salads. Of course, you can use it for this sesame tofu wrap, but it is so delicious and it's so easy. So we're going to use the recipe calls for 1/8 of a whole egg. Okay, I want to make sure I'm getting everything because I've got 3 different things going on here. I put rice vinegar again. So we have 2 layers of the rice vinegar. So now you're layering your flavors in your food, and it's a very nice pairing. And then we've got a half a teaspoon of sesame oil, and toasted might give you just a little bit of another umami flavor and not change your calories or such. And then it calls for a neutral oil. This recipe is calling for half a cup of canola oil. And you're going to actually use a mixer just to blend that, emulsify it so that it holds together. And that will go on your actual whole wheat tortilla wrap. So this is going to be what we're wrapping it in, and it's whole wheat, so another grain bread that's going to be good for us. Now we've got our dressing, and I really like to recommend when you're looking at a recipe, when you're making it, what we do in the kitchen, commercial kitchen, and the only way we can, stay on time and get your food out when you come into a recipe is that we do what we call mise en place, things in place. So I've organized all my ingredients. I have my panko that we're going to be dipping the tofu in. It's got the dry basil and it's got a tablespoon of sesame seeds. So I have everything in place. So I don't have to, once I get into cooking, go, oh, I forgot something, or I don't even have it in my pantry. And that's the worst place to be. So for any recipe, especially the AAKP delicious recipes, when you look at it, when you pull it up, gather everything and then go ahead and measure everything out. And then you can just focus. You can put your best music on. I find cooking is so meditative, even when I'm in the hustle and bustle of the commercial kitchen. And then the recipe also calls for your, favorite leafy greens that you can put on. Anna Marie, how does that sound to you? Does that make
sense? It sounds so delicious, and I'm tasting the flavors as you're talking about it. And what I'd like to point out is because these are plant sources. You got the whole grain tortilla, you got the veg, the planko. All of these, none of these are processed foods. They're processed only to a point. They're minimally processed, but they're plant sources. And the phosphorus that comes from these foods is not going to be absorbed 100%, 50% best at the very most. But I agree. Now, did you toast the sesame seeds before you added them to the planko?
I did not, but I'd recommend it.
Oh, okay. I was curious about that. Okay.
Yes,
okay.
I didn't. You have the dried basil. That's what you're seeing, the specks. And then there's a tablespoon of the sesame seeds. And I was kind of mixing it as it came to my head. So the next time around, because I'll be making this again to eat, I'm going to do that, because when you toast seeds or nuts, it just brings up a lot of the umami and it's a more earthy depth of flavor. And I'm all about flavor. So let's get this party started, because I know we have so many things. I'm just going to go ahead and take my marinated tofu. I just want to drain it just a little bit, but I'm going to sit it right in. It calls for a whole egg. So you want to just get it coated well in the egg, because that's going to be the binder source. I'm going to get my hands in it because they're clean, and this is going to be my meal. In the kitchen, we always have gloves, and I just like to touch my food, especially when I'm cooking it. So I want
and you're the one that's going to eat it, so it's fine.
I'm going to eat it. I mean, there was a time where we just really washed our hands all day. That's why you look at any chef's hands; they're pretty dry, no matter what lotion we put on. But I understand. We do what we need to do. All right, and I just want you to see how you want to get this nice coating, and that dipping it in the egg source is going to hold it on there. Let me get my power source on, You might hear a little bit of a singing noise. Hope it's not too much. Now I'm going to take two per tofu wrap. We're going to take two of the, I'm going to call them tofu sticks, like you might think of even fish sticks. And we want to just do the same thing and baste your tofu in the egg source first. So I even line my things up. So I don't have to remember what am I supposed to do first, because someone might dip it in the panko and then try to dip it in the egg. So lay everything out. And if you have family, this is a great thing, especially with kids, to make with them and have them get their hands in it. I started
That
cooking
was
at 8 years old.
that's what that's what came to my mind when you were explaining it. I could visualize the family working together to
Yes,
streamline and fun the process. It's so much fun.
exactly. Because when any of us put our hands, as you spoke, Anna Marie, to make our own food, when we have our hands in our own food, it's a different kind of magic. And you can
Yeah.
kind of hear the sizzle that's going on with the tofu that we're doing here, but it's holding together. Don't worry if a little bit falls off. I just pick those bits up and put it right in my wrap. And you want to just lightly, I like to, again, bringing out more flavor, you can just warm your wheat tortilla, and we can put that just over the gas stove. I'm just not going to do that right now. You lay everything down. You want to put your lettuce down. You want to put a little bit of your dressing, drizzle it over the lettuce. And then once these get done, you let them just cook for about 1 to 2 minutes each side. Oh, it's already, let me show you. It's already looking so good.
That
All
dressing
right, I
could
know
be
it's
used for anything too. It seems very, very versatile. Ooh,
You see
scrumptious.
that toasting that it's getting, the
Yes,
browning and that
delicious.
crispiness. So you don't have to deep fry. You don't have to, put it in vats of fryer. I know some of us grew up like that, the fried chicken and all, but that's another story for another day. We don't want to get those acrylamides. So I'm just doing what we call a pan searing, but the oil, and then you've got the coating that we have is going to come together. And just like magic, like TV is, we're going to make this beautiful sesame
Mm,
tofu wrap. So I have in there the tofu sticks that I've dipped, and what you see, you can hear, and you can see maybe even the steam. And then I've already toasted just slightly to get it a little more pliable, because I keep my wheat tortillas in the refrigerator so they're cold. But when you warm them like you toast bread, they get more pliable. I took a little bit of leafy greens. I even drizzled some of the dressing through the leafy greens and massaged it a little bit. And then if you
nice.
like, you could pour your dressing, for your offering to your family. You could just pour it and they could just dip it a little bit. Some of us like that dressing, but not too much because we don't want to get too crazy with the calories.
Right.
And
But tofu
voila,
cooks really fast. I mean, this is a
it does.
very, very quick and easy meal on a very busy day. Oftentimes, patients have many appointments or they might be very
Yes.
tired, and they can cook this very rapidly. And another thing you pointed
Yes.
out that was
And it
very,
holds.
yeah,
I'll
one
make
thing,
it and then take it with me somewhere. It holds really well because it's
I love
in the
that.
wrap. And just take
Nice.
some parchment paper and then put it in whatever you're carrying your lunch in. The parchment paper will just make sure that it doesn't, because there's moisture, there's the dressing and such, and it will hold it together, and it will hold the tortilla. Just, it's not even, I made this a little while ago because I was
Beautiful.
testing it. I'm going to eat it later. So that's what I have for you, everyone. I hope
I
I've
wish
whet
I
your
was there with
appetite.
you to eat.
I wish you were too, because now I have two and I don't really want to eat both of them. So what I do, I won't. I'll wrap it and I'll put it in my parchment paper and I'll just put it in the refrigerator, because the nice thing about this it's nice if the tofu is warm, but it's also nice if the tofu is cold because you've
Right.
already marinated it and it just has all that flavor. So
Right.
that's what I have. Thank you for having me.
Oh my
I would
gosh.
love to take it to the phone or the computer. I wish
I
I could
wish
serve you all.
I wish all of us were eating together. One of the things that you brought up that was really important too is that planning ahead or cooking ahead when patients are going to dialysis or multiple appointments, they're sometimes they come home, they're pretty wiped out and they're very, very tired. But having something that's easy to prepare, something that's pre-prepared and ready to grab, such as what you just said, it's already wrapped and ready to go, that makes it so much easier to come home after a long session of dialysis and then have this delicious meal ready to go. So wonderful.
Yes.
I love it.
Yes. Thank you. And you can take, like I said, you can make 6 of them and you don't even have to wrap them all. You could wrap 2 and you could hold each of the individual items separate and then just assemble it. It's not even cooking any longer. It's just assembling. So thank you again for having me, Jerome, AAKP, the whole team, and everyone that's joined us today. I'm thrilled to be here.
Well, thank you, Anna Marie, and thank you, Chef Curtis. That really did look delicious. I wish I had some right now. So, again, thank you both for the great demonstration and for sharing practical tips on phosphorus management. Now, Anna Marie, before I let you go, I'd like to pose a few questions, additional questions that were sent to us as people registered for today's program. And one of the questions is, how does managing phosphorus differ between dialysis patients and those who are not on dialysis?
Thank you, Jerome. And this can be very troublesome and tricky because not any patient, we can't consider any person to be a cookie cutter. No body works the same exact as another body. And as kidney function declines, the body goes through changes. The phosphorus management can become more difficult. Ultimately, our body, our kidneys can help manage phosphorus for quite a long time. So usually during stages 3 to 5, not being on dialysis, we still have enough kidney function to get rid of the bulk of the excess phosphorus. But as kidneys continue to fail, the function continues to decline, then it becomes more difficult for our phosphorus to be managed within the normal range. And we do need then that extra help that we might need to take medications to help navigate that phosphorus control. And definitely once a person is on dialysis, remember when I use the examples of how much protein is needed on dialysis versus not on dialysis and how much that can impact the phosphorus intake. As we eat more protein, we will take in more phosphorus. So when a person is on dialysis, their protein needs go up. And because of that, to meet those protein needs, they will then ingest or eat more phosphorus. And it's not that anyone is doing anything wrong per se, it's just meeting the body's needs for protein management to keep ourselves healthy and strong. So definitely when someone is on dialysis, diet is typically not going to be sufficient to manage phosphorus, and that's when binder medications or phosphorus medications such as binders or blockers might be necessary to help.
Yeah, thank you for that. We got
Yeah.
one more question for you. Are there
Sure.
any potential are there any potential side effects from using phosphate binders that patients should be aware of?
Yes, absolutely. And I don't want to sound flippant when I say this, but the side effects can be just as typical as any other medication. And so that's why it might come off as sounding a little flippant. But the side effects are usually GI in nature. And if you look at most medications, no matter what you're taking, even some multivitamins, sometimes they cause some GI side effects as well. But typically what you would perhaps experience as far as a side effect is maybe constipation or diarrhea, so it can be one extreme to another. Sometimes nausea, maybe vomiting, but I've not seen too many of my patients experience that. It's usually either the constipation or diarrhea, or maybe some bloating, some GI discomfort. Those are usually the experiences my patients have had with phosphate binders or medications. I think also too is it's important to ease into the therapy. If a binder is prescribed at a very high dose, then the patient might exhibit more signs or symptoms or side effects. It's better, even if the patient does need a higher dose, it's better to start out low and work into a higher dose that's needed. And that's something to remember too, is that when our kidneys continue to decline and our phosphorus is not as well managed, we might need only one medication, one binder per meal. And as kidney function continues to decline, and eventually if we are on dialysis, then that binder dose may need to be increased to 2 or 3 per meal. That's not that the patient is doing anything wrong, but it's just the simple fact that the body cannot eliminate the phosphorus as efficiently. And I think that going into the phosphorus regimen, the binder regimen, slowly is often much more helpful. And there are other options. And now we have these novel phosphate blockers that can be used as well. And they're only taken once or twice a day. So there are still side effects. Like I said, every medication has side effects, but easing into medication, I think, is a lot easier.
Anna Marie, we appreciate you answering a few more questions that were submitted in advance from our audience. Now we'd like to hear from a couple of our AAKP ambassadors who will share their perspective and experiences with managing their phosphorus levels. First, Brandy Nunez is a AAKP ambassador and kidney transplant recipient from Louisiana. Brandy was diagnosed with kidney disease in 2014 during an annual checkup. Due to a genetic condition, her kidney function rapidly declined, and by September 2017, she required dialysis. Determined to maintain her quality of life, Brandy chose home hemodialysis, a decision she considers the best treatment choice for her. Despite the challenges of dialysis, she continued working full time, scheduling her 4 weekly treatments around her busy schedule. Brandy is now a proud kidney transplant recipient and remains committed to empowering others. She encourages patients to explore home hemodialysis and take an active role in managing their condition. Her advocacy efforts include being featured in AAKP's National High Potassium Awareness Day and National Phosphorus Awareness Day campaigns, where she has shared valuable insights into nutrition management. Brandy, welcome to the program.
Thank you.
Can you tell us a little bit about your kidney disease journey and when you learned about the importance of keeping your phosphorus levels in check?
Oh, goodness. So I was probably stage 4 when I had first heard of phosphorus. Um, Stage 3 was all about maintaining like electrolytes. And I thought I had a pretty good balance on everything. And then one visit to my nephrologist, and out of left field, they're like, "Oh, your phosphorus is high." And I'd never, ever heard of this before. Like, phosphorus, what is that? Like, that's like a gas, right? Like, you're making this up. Um, Unfortunately, they were not. So I had to educate myself about phosphorus on top of, having this frustrated emotion, thinking that I was starting to finally get the hang of my kidney disease. And through that journey, like I said, it was an education process. And what the reality of the situation is that phosphorus, once it gets too high inside of your body, it will pull calcium outside of your bones. Like, it will literally thin out your bone density, and it will deposit that calcium into your arteries and your organs. So essentially, your veins, your arteries, your lungs, your heart, it just basically gradually turns to stone. And that's kind of scary. Not only learning that, high phosphorus is a real thing, but your body could be essentially turning itself to stone. Like, oh my goodness, this is a whole nother challenge that we face. So just with everything else with kidney disease, it was kind of a grieving process. What is phosphorus? How do I control it? Do I just, does everything suck again? Like it was definitely a grieving process. Another roller coaster of emotions I went through when I was notified that my phosphorus was high.
What were some of the challenges you faced when you first started trying to control your phosphorus levels? And how did you overcome them?
Phosphorus is managed by your diet because it enters your body through your diet. For me, it was a combination of managing the foods I ate as well as taking phosphorus binders. So there are various companies that put out phosphorus binders that your nephrologist will prescribe to you. And depending on the type of binders that you have, depends on how you have to take them. For me, I had to take it within 15 minutes of eating a meal. So it was kind of like, hold up, am I ready to eat dinner? Did I take my medicine? In addition to managing my diet, because when I first found out about phosphorus, again, it was still just an education process. It's like, well, yeah, there's foods that contain phosphorus, but the labels don't all say that your foods contain phosphorus. So with it not being a requirement on the labels in the grocery store, like, how do I know what I'm consuming? So between guides that my nephrologist had, my dietitian, different things I found online through pharmaceutical companies, really helped me kind of have an idea of the foods that were not very good for me versus the foods that I could maybe eat a little bit more leniently. So that in itself helped. The real point that was driven home, I was actually at a doctor day. And for dialysis patients, your doctor day is where you go to the dialysis center, you see your nephrologist, you see your nurse, you see your dietitian, you see your social worker, and basically have all your appointments in one day at the center with those medical professionals. And I was just having a frustrated conversation with the dietitian. I was like, it's like, you don't really know what you're eating. You know that, like, okay, so I'm eating shrimp, but how much phosphorus am I consuming in my shrimp? How much phosphorus am I consuming in my eggs? And so, my light just went dead. So that for me was a struggle. And this dietitian that I saw that day said, well, phosphorus is a preservative. And it was like a light bulb went off. And I was like, oh, well, then I just have to make everything that I eat. And so that control, the ability to make the things that I ate, was like basically kind of a way for me to reclaim some of what I had lost going through kidney failure. You don't have any control over anything your body does during kidney failure. And that was just a way for me to kind of reclaim part of my body, and part of my illness was that if I wanted things, I would just have to make them.
Yeah, you just talked a little bit about taking a phosphate lowering therapy or a phosphate blocker to keep your phosphorus levels in check. Can you provide tips on how you use them consistently?
So The first thing I did was I always had them with me, because it didn't matter if you were eating a meal, if you decided you wanted a random snack, you needed to take them. So I always had them with me. At meal times, I would more so set a reminder, because you can set reminders on your phone for everything now. So I would set a reminder, hey, don't forget to take your medicine. And that it got to a point to where I would sit down to eat, and it was a natural thought to have, did I take my medicine? Wait, let me not take this bite of food. I didn't have my medicine yet. And so it eventually became a routine.
Yeah, I understand. You're from Louisiana, a place known for having very flavorful foods. Are there specific foods or meals you had to avoid to adjust to your phosphorus check? And how did you do that while maintaining, the culinary staples of Louisiana?
Oh my goodness. Kidney failure in Louisiana just isn't fair. Because our diet it's not only seafood, it's not only shrimp and crawfish and crabs, it's sausage and boudin and bacon and ham, and oh my goodness. It was difficult, but it's something that you definitely had to be mindful of, especially if there was maybe an event that you were going to, and you say, okay, well, there's this festival, because we have a festival for everything in Louisiana. So there's a festival, and it's like, okay, well, it's going to be like a jambalaya festival, so everything's going to have sausage, and part of sausage is phosphorus. So you definitely had to be like, okay, in the days leading up, you really just had to make sure that you didn't eat those basically any processed foods at that point. Like, you really just had to balance it, but more so to say, okay, these few days I really need to be easy on my body, because I know this is coming up and I know I'm going to want to enjoy these things, and I know it's going to be difficult, but as you still had to try to live your life, and balance, really balance is where you lived. You had your days where you enjoyed everything you wanted to enjoy, but then you had to have your days where you ate what you didn't want to eat, because
Yeah. So, in addition to medication, knowing what nutrients are in your foods plays a big role in helping managing your phosphorus levels. So, how important was reading food labels to your daily success in keeping track of phosphorus consumption? And do you have any advice for spotting, the hidden peas, the hidden phosphorus packaged foods?
so that was probably one of the most difficult things I went through in my journey, because phosphorus is not something that's required to be on a food label. So, as most people know, if it's not required, why do we need to do it? So that was very, very difficult. But I would still read labels. There would be certain meats that maybe have only 1 or 2 phosphorus ingredients, versus other meats may have 4 or 5 phosphorus ingredients. So that was one of the things I really tried to pay attention to, because again, like, we love sausage in the South, we love bacon in the South. It's nothing for us to throw a ham sandwich together. So that for me was really just looking at the ingredients and gauging again, like, okay, does this one maybe have more than that one? Because there's not percentages on the back of the food products. Like, you're not going to find that. And it's really unfortunate. And if I ever have an opportunity to have anything to do with the FDA, I would like to that would be one of the things I would like to try and have changed, because it really does affect, these ingredients affect your life. And to not know how much they're affecting your life is very, very unfortunate for us.
One last question for you, Brandy. What advice would you give to someone who is just starting to manage their phosphorus levels and maybe feeling overwhelmed?
It will get easier. It is one of the few things you can control. Because again, like your body's going to do whatever it's going to do while you're going through your kidney failure. Your numbers are going to respond how they're going to respond. But what you can manage is, again, making sure that you focus on those foods that are less phosphorus involved. For example, there are certain cheeses that have less phosphorus than others. There are certain meats that have less phosphorus than others, things like that. I know you're probably going to want to go through the drive-through and pick up some, fast food French fries. I would recommend not doing that because, again, phosphorus is a preservative. It's going to be in those fast food French fries. But like I said, it's very difficult at first. Like, nobody wants to hear that they have to change their diet. Find ways where you can win over that situation and then hold on to those, because those are going to be the things that you can control in your kidney failure.
Brandy, thank you for being with us today to share your experience and your perspective. Our next speaker is Precious McCowan, a dedicated kidney patient advocate from Texas. Despite facing multiple transplant failures and years on dialysis, she has remained committed to improving kidney care and policies worldwide. For over a decade, she has served on key advisory boards, including the ESRD Network 14 Patient Advisory Council, the ESRD National Coordinating Center, and as an AAKP ambassador. A strong patient voice, she played a pivotal role on the UNOS EGFR committee, ensuring equitable policies in kidney transplantation. In 2024, she received her third kidney transplant, and in 2025, she earned her PhD in philosophy. Please welcome Dr. Precious McCowan. Hey, Precious.
Hi, Jerome. Thanks for having me.
Thank you. Thank you. So, my first question, just tell us a little bit about your kidney disease journey and when you realized the importance of advocating for yourself.
Absolutely. Thank you so much. So, I was diagnosed with stage 3B kidney disease in 2010. And from there, within that same year, my kidney disease progressed into end stage renal disease, ESRD. So at that time, of course, I was placed on dialysis, and the modality that was introduced to me was in-center hemodialysis. So also during that time, I was placed on the kidney transplant wait list to receive both a kidney and pancreas transplant. And I was fortunate enough then to only have to do dialysis for 4 months before I received both a kidney and pancreas transplant. So I was excited during that time. I thought life was back on track for me, that I could return to work full time. But unfortunately, both organs only survived for 7 months. So I was back on in-center hemodialysis for an additional 8 years. But during that time, I must admit, the first year and a half, I was not in tune with my health. I didn't understand what advocacy meant. I didn't know what questions to ask my care team to better manage my care. And I also was dealing with, I was depressed, and I was also still grieving. 4 days before both the kidney and pancreas went into rejection, my 2-year-old son passed away, which devastated me. He was my life. He was my world, and I was lost. However, I did not address those issues, those mental issues effectively. So I say that to say that that experience was bittersweet. Bitter because my son was the love of my life. Sweet because my husband and I, we donated his organs to be a blessing to someone else. So fast forwarding, once I returned back to in-center hemodialysis for a second time, I was hospitalized. I was in and out of the hospital. I struggled a lot with my care. I just remember one day I had a vision about my son, and I was like, he would not want me to live like this. And from that day forward, I decided that I would not let kidney disease defeat me. So I began to thrive on dialysis. I began to become engaged with my care. I began to, kind of ask questions or think of questions I could ask my care team where I could better manage kidney disease because that was new to me. So that's how my advocacy journey began. It began with me. It began with me wanting to engage with my care team. It began with me wanting better for myself and better for my family. So that's how my journey began as an advocate.
Yeah, I'm so sorry to hear about the loss of your son. Um, what challenges did you face in, managing your phosphorus levels, and how did you address them?
Yes. So funny story, that to you, Jerome, and to the audience. It's not funny, but when I think about it, I was like, oh my gosh, my health literacy was really low and I really didn't understand. Um, I remember my dietitian approaching me saying, we're going to start you on a phosphorus binder. And at this time, this was my second time returning to dialysis because the first time I only did it for 4 months. And at that time, I didn't need phosphorus binders. So the second time, she was like, we're going to start you on this and you need to take it. Every time you have a meal. It's very important that you take it. And I'm like, oh, okay. But I'm thinking in my mind, mm, I feel fine when I eat. Why am I taking something when I eat? Why am I taking a binder, another med added? I wasn't, it wasn't clear to me and I wasn't down for it either. So it wasn't until my social worker he approached me and he gave me a flyer about a kidney event that was taking place in my city. So I was like, oh, why not? I'll go. It was a event that was educating both patients and their care partners about kidney disease. So I was like, oh, I'll go and see what this is about. So I went to the event, and one of the workshops that was being hosted was a phosphorus workshop. And I was like, I'll check this out. I've heard about this in my facility. The dietitian and my nephrologist has, brought this up to me and saying I need to take this binder to control my phosphorus. So I'll go. So at that moment, I sat in that session and I was scared straight. I had no idea the issues that high phosphorus levels could cause on an individual on dialysis with kidney disease, period. I saw photos of how it could deteriorate you from the inside out. I saw that people were very sick. I saw photos of people with sores and everything that you could think of, and it scared me straight. And to be honest, from there on out, I was like, I'm taking my phosphorus binders. So that was the first time that I really took phosphorus control seriously. I saw the images, I heard the information, I heard that it can even cause death. So I was on board with taking my binders as directed from there on out.
Yeah, yeah. How has having a choice in your treatment options affected your quality of life and overall health?
Great question. Fast forwarding to me being an activated patient, a patient that's involved with her care, a patient that works with her healthcare team and advocate for myself and my peers. That is very meaningful to me. When I think about the phosphorus binders, I remember my dietitian showing me a chart of, like, I know it was over 30 binders that could be used to control the phosphorus. And so we kind of struggled. We went back and forth as to determining what binder will be good for me. I have GI issues. So every binder wasn't good for me. So we went back and forth until we found one that worked. So having those options was very important. And I'm a strong advocate, and I always say too that I know that one prescription does not fit all. So it's very important to have those treatment options.
What advice would you give to other kidney patients who may feel hesitant to speak up for themselves or ask about new treatment options?
Yes, Jerome, that's something that I do as well. The advice that I would give to individuals that are, hesitant or don't feel confident about speaking up is that you are the captain of your ship. Yes, your healthcare team, they are the professionals. However, you are the expert. You have lived with your body X amount of years. You know yourself. If it's something that you don't understand, ask about it. I used to be one of those people. I'd be like, well, I don't really understand what they're talking about. I'll just agree and nod my head. No, you can actually save your life by speaking up and asking questions. There's never a dumb or stupid or uneducated question. Speak up for yourself. You only have one life. Your health is very important to live that life to the fullest and to have a good quality of life. So don't be afraid. Speak up, talk to your healthcare team. And one thing too, I want to add, I know that sometimes you know the nephrologists or the care team in dialysis facilities, they get busy. If it's something that you're not understanding, pull them to the side. Say, I know that this is a busy time, but can we find some time where I could talk to you about my health care, or talk to you about this new prescription that you prescribed for me? I have concerns. Always address your concerns. Of course, do it respectfully, but work together as a team. You are in the center of your care, and never forget that. Nothing about me without me.
Thank you, Precious. We appreciate you sharing your story with us as we recognize National Phosphorus Awareness Day. You can find today's featured recipe for the sesame tofu wrap within the 8th edition of the AAKP Delicious Recipe Series. A link to the recipe can be found in the confirmation email sent to you for today's webinar, as well as on the AAKP website. The AAKP Delicious program offers over 100 kidney-friendly recipes designed to help you prepare healthy and delicious meals that align with your kidney diet. Recipe ingredients can be modified to fit your specific needs. Be sure to consult your renal dietitian if you have any questions on how to incorporate any of AAKP's recipes into your daily diet. Purchase all 8 editions of AAKP Delicious online at aakp.org/shop and start your collection today. Please also visit the Hidden P in Kidney Disease.org to access more phosphorus related information and resources you can download at no charge. In closing, we are excited to announce the dates of our 2025 events. The 7th Annual Global Summit on Kidney Disease Innovations, hosted by AAKP in partnership with George Washington University School of Medicine and Health Sciences, will take place virtually May 22nd and 23rd. Registration is free and is now open. The 8th Annual AAKP Public Policy Summit will be held on June 27th at the National Press Club in Washington, D.C. Registration for this free event is now open, and a virtual option is available for those unable to join us in person. And the 50th Annual AAKP National Patient Meeting will also be a hybrid event taking place October 3rd through the 5th. This is our golden year for the patient meeting, so it's a not to be missed event. Additional details on location and registration will be announced soon. Please continue to visit our website and follow us on social media channels to keep up to date on the latest events and information. Finally, you can visit our special AAKP On Demand webpage at bit.ly/AAKP On Demand to watch a number of great presentations and webinars, all available on demand from our 2024 events and programs, as well as the 2025 programs as they occur. You can also visit the AAKP YouTube channel at bit.ly/AAKP YouTube for more great content. We'd like to extend our sincere thanks to our outstanding speakers, Anna Marie Rodriguez, Chef Nina Curtis, for leading such an engaging discussion on high phosphorus and teaming up for a fantastic cooking demonstration. A special thank you as well to Brandy Nunez and Precious McCowan for sharing their personal journeys and valuable insights on managing phosphorus. We're truly grateful to everyone who joined us today and to our generous virtual event sponsor, Ardelyx, for supporting this year's National Phosphorus Awareness Day efforts. Thank you again for being a part of today's event. We hope you have a wonderful rest of your day.